the majority of Democrats overwhelmingly for this, the majority, and overwhelmingly so, of independents for this bill, and overwhelmingly Republicans were for this bill. Notwithstanding that fact, too many Republicans decided not to side with all of those people and all of those groups, but rather to side with the President of the United States, who said no to including more children. This was directly contrary to his promise in 2004 that he wanted to add millions of children to the child health insurance program, which were then eligible but not included. The bill that failed to have its veto overridden today did exactly what the President promised to do.
Earlier in the year, 2007, President George W. Bush vetoed the S-CHIP bill, which would add an average of $7 billion a year to the state children's health insurance program. This act of the President is contradicting his promise during the 2004 presidency to ensure 10 million more kids in the program. Is health care a birthright of every child, or is it a privilege?
It's one of the most important questions we have to deal with right now. And I'd like to not ACLU just as a citizen. I'm for it. I'm for free child health care beginning now. But speaking as a member of the ACLU, there's a complementary answer, and that is we want people to grow up healthy.
I think it's unnecessary. I believe that in any state, any community, when you walk through the emergency room door, you'll receive care. So to say that we need to expand health care is a misnomer. We're trying to redefine terms. If we're talking about insurance, there may be a small percentage of children within this community and well statewide that may not have health insurance coverage, but no one has ever denied health care.
I believe that child health care should be expanded. I think it can be done at a reasonable cost to the country, to the taxpayers. I think children without health insurance, families that cannot afford health insurance for the children, are the weakest and most vulnerable members of our society.
And now you have this free health care, well, with S-CHIPs, reduced health care. I mean, that is reduced as far as what the parents would pay. But ultimately that's just a stepping stone down towards total health care for children and then for everybody. Because why? Because we've advocated our responsibility, our personal responsibilities in providing that not only for ourselves but for our families, including our children. Hello, if you're going to have children, you need to be able to take care of them and not depend on the federal government. And what happens when you depend on the federal government to take care of your children? You got to go by their rules. You got to do everything they say. You give up personal responsibility. You give up personal freedoms. Dead set against it.
I think it's really important to make sure that every child in America, particularly in the state of Indiana, has access to health care. Because so much about the development of children, whether they're going to be healthy, affects whether they're going to learn and what kind of adult they'll grow up to be.
We're the only industrialized First Nation world, what do they call it, upper tier of nations. We're the only ones without free health care. It ought to be free. We ought to take health care out of the market and say this is a birthright of every child to get free health care.
It was the right thing to do. The S-CHIP program would have made me and my family eligible for S-CHIP benefits, and I would have actually been required to leave my private insurer and accept S-CHIP coverage through this new program. And it's wholly inappropriate. I'm more than capable of providing for my health insurance benefits, so there's no need to insure a larger pool of people. There's also no justification in providing health insurance benefits for individuals that are not U.S. citizens.
I think our elected officials, all of them, the President, Congress, the Senate, the House of Representatives, have an obligation to help the weakest members of our society. And this is one way of helping them. So I was very, very disheartened when I heard about that veto.
Excellent. All for it. And again, don't want to sound like someone who hates children. I love children. I've got 3 grandchildren of my own. Do anything in the world for them. But I'm the parents. I'm the parent and then the grandparents. But again, personal responsibility. And we need to be teaching that. We need to be preaching that. But instead, we're not. It's taboo almost to even say that. And so what happens is the federal government is begged to step in and take the place of the parents and the grandparents.
I was disappointed by that because I think that Congress wanted to expand the children's health insurance program to cover more children is a good thing. And I think that as each month goes by, more and more people in the middle class, even people who have jobs, 2 jobs, work really hard, they're losing their health care coverage because their employers can't afford to provide it. And so I think the program needs to expand to make sure we pick up those children that are more and more in the middle class that don't have access to health insurance because their parents' job doesn't provide it anymore.
The expenditures that people talk about that would finance this bill are, say, in the neighborhood of, I think the numbers that people use are $35 billion over a 5-year period, and if you want to make it more expensive, that would be, say, $50 billion over 5 years, so $10 billion per year. I always find it useful to think about how much this would be per person in this country. So last night I calculated this, and it would be $30 per year per person in this country. So for the middle class person that goes to Starbucks periodically, that would be about 10 cappuccinos that they would have to give up over the year.
For the total bill over the next 5 years, which would make a total cost of $60 billion that it would increase. It's supposed to be funded by increasing the tax on cigarettes, which at some point that money is going to run out.
So now we're asked to support child care, free health care. Man, you know what? There aren't little elves out there making drugs. There aren't little elves out there providing surgery and fixing broken bones. I mean, somebody has got to pay for it. And it's going to have a devastating effect on our economy.
If our public health care system is expanded a great deal so that access is guaranteed for all children or all citizens, that would probably require an increase in taxes or cuts to other places where taxes are being spent now. So it would create a lot of, we have to set priorities. So if we believe that health care for children is a high priority, one of the highest priorities, and that's a good way to spend our taxes.
It would have crippled the economy because it would have crippled the healthcare industry, which is 1/7 of the overall economy in the United States.
Leads more to government dependency, or dependency on the federal government. The federal government steps in, and again, you don't get free stuff from the government without giving something up, and you give your personal rights away. Dead set against it, and it's already having a deleterious effect on not only the mindset of the country, but again on the economy. But the mindset, I think, is the biggest thing. We're dependent on the federal government to take care of our every need.
Well, the biggest issue anytime you have a government program is to make sure you can pay for it. And so they can be expensive. And so Congress needs to make sure that they're raising enough revenue and they're choosing their priorities correctly to make sure they can pay for the program. And I can't think of too many programs that should be of a greater priority than making sure that children have access to good health care.
The biggest con is that, one, it would have expanded health care coverage to individuals that are more than capable of providing their own health insurance benefits. 2, it created a false premise that people were in jeopardy of not having health care, and that's simply not the case. You can receive health care anywhere in the country, any community, by simply walking through the emergency room door.
We need to find a way to make healthcare affordable. I don't think it should be free, but it should be affordable.
We as a society can bear the cost of that program easily. There are many other government programs that government expenditures that could be cut to finance this particular program without much damage to the rest of the economy.